And Susanne, whenever you're ready, you can go ahead.
Perfect. Okay, so welcome everyone, and thank you for coming to listen to this presentation today. What I'm going to do is I'm giving you a snapshot in time, a snippet of information, and I'm trying to leave lots of room for discussion at the end. Okay, so bear with me as I go through the next series of slides. If ever we don't answer all your questions within the time allotted, don't hesitate to email me, and I'm happy to respond by email as well. Just begin by sharing my screen. Everybody sees the presentation slides? Great, excellent. Just gonna move some of these controls. So before I begin the presentation, I'd just like to make some acknowledgements and thank some very important people who've been key to supporting me during this PhD journey and this sort of journey into research. So I'd like to thank, of course, Aliki and Matthew, my PhD supervisors, who have been instrumental and really, you know, they're the voices I often hear in my mind that help me to stay on track, to prompt me to reflect further, and to ask myself the challenging questions that I don't necessarily take the time to do. I'd also like to thank Serena Riccio, who is a colleague of mine, who was the second reviewer in the scoping review that I'm going to share today, and the other members of my thesis committee, Salim Razak and Kelly Root, who's a speech-language pathologist at the School of Communication Sciences and Disorders. I'd like to also thank family, friends, and colleagues. I have some of my colleagues here today and some of my colleagues from my the research labs that I'm part of, and I really thank you for your presence and your support, and for any challenging and interesting questions that you might ask me today. So I'd like to start by just talking a little bit of who I am, and I think that helps to shape why I've gone into this work and how that's evolved over time. So I'd like to just start by explaining, you know, I always tell my students when I present in my courses, I'm like part of the McGill spot furniture. I've been there forever. And, you know, I see every stage of going into a new graduate studies or a new position as a somewhat reinvention of myself. But, you know, my journey started, you know, years ago, a little over 20 years ago, as a student in the BSc OT program at McGill. And right after I completed my degree, like many of my colleagues, I went out and I started practicing, and I practiced in a variety of different settings, mostly related to patients who had some sort of respiratory conditions, COPD, asbestosis, pulmonary fibrosis, etc. That was really the bread and butter of what I did. I also worked in palliative care. I worked in long-term care extensively. And towards the end of my time in the public sector, I worked in seating positioning at Constance Lethbridge Rehabilitation Center. So I've done a variety of different things over that short period of time. And after that, I went into private practice, and I worked in private practice for a number of years. You know, and during my years in the public sector, they were really informative. Not only did I experience, you know, the challenge of transition to the workplace that many of us experience, the challenges of becoming a professional, of developing clinical expertise, trying to figure out how to navigate the healthcare system, etc. But I also learned aspects about myself during those years. Things I liked, things I didn't like, things that influenced my practice, things that made me question whether or not I fit in the profession, were all things that really helped me to think about where I want to go with my journey and where I want to end up. And some of those experiences related to clinical education, being a supervisor for different students and really enjoying that experience was what led me to McGill. And so I've been at McGill since 2004, and I've done a variety of different things. And currently I am a PhD candidate in Rehabilitation Sciences in the PhD program, as well as wearing multiple other hats in the OT program. Okay, so lots of those experiences, the clinical experiences that I obtained, along with some of my professional working experiences, in addition to my student experiences, are all things that sort of shape me onto this path and onto this journey of asking the questions related to, who stays in the profession, who leaves the profession, and what the reasons that lead them to in those directions. So I'm going to start by just giving a little bit of a snapshot of some evidence that we already have out in the literature. And you'll be interested to see that the first line of this slide relates to Quebec data. And so the ministry actually ran a study they published it around 2014, but it ran for a couple of years in that period. I believe it was 2010 to about 2013, in which they estimated that about 10 to 15% of OTs, PTs, and speech language pathologists leave their profession within 2 years of graduation. And in that study, they did not explore the reasons for that attrition. They just estimated it's about this. And some of the more simplistic reasons that they offer are things like retirement, parental leave, and death. And then there's this sort of vague statement about other reasons, in which that sort of feeds into the why or the rationale for pursuing this sort of line of work of research. The other data that we've also seen is from Australia, in which, in a study that was conducted on graduates from Curtin universities and PTs, of the 256 PT graduates that they surveyed, 65% foresaw that they would be leaving the profession within 10 years. So that also gives you a sense of attrition being something that's a notable issue for us to tackle. In terms of the reasonings for why the PT graduates wanted to leave their profession, related to aspects of remuneration, so pay, also with respect to the recognition of their work. And part of it was also related at a professional level, the marketing of the profession, okay? In terms of other sort of studies related to attrition, in particular to the OT profession, there are not that many. There are two sort of seminal papers back in the 90s where we talk about things like caregiving and familial commitments, wanting a career change. But as you can tell, that was a long time ago, and it's time to relook at the data and to see what else is out there and to produce new research. And certainly, as you can imagine, and we're living it right now in this pandemic, if we don't have the sufficient manpower, our healthcare system cannot run. And that means that we can't meet the needs of the individuals in our community. And so that sort of leads into the objective of my PhD work, in which the overall objective is to investigate why OTs, PTs, and speech language pathologists choose to stay in or leave their profession. And specifically, there are 4 particular things I'm looking at the influence of educational and healthcare environments on their decisions to stay or leave their profession, looking at differences and similarities across the 3 professions in terms of the things that influence their choices, understanding stakeholder perspectives on attrition and retention, so employers, professional associations, regulatory bodies, and educational programs. And when I'm looking at educational programs, I mean to say professional training programs for OTs, PTs, and speech language pathologists. And finally, the last step is generating potential retention strategies for Quebec OTs, PTs, and S-LPs. So how am I going to do that? Well, there are 3 phases to my work, and in which, phase 1 is what I'm going to talk about today. And just to situate a little bit, the first two phases have already been completed. I'm actually in the 3rd phase now of conducting focus group with stakeholders. But as I said, the focus really will be on phase 1's findings. And really the methodological approach that I'm using is interpretive description, which is a qualitative research approach, and the theoretical framework that I'm looking at that will help to inform some of the data analysis is activity theory. So I'm going to go right into the scoping review and talk a little bit about that. So the question that we asked was, what is known about attrition and retention in rehab? And so I used Arksy and O'Malley's scoping review methodological framework that's informed by Liebeck and al. In 2010. And we did a search of several different databases. And we focused our search from 2010 to July 2020, in which we reran the search last April. And we focused on that time period mainly because we were trying to look at contemporary contextual factors and experiences, similar to what we're somewhat experiencing today. And so that's what we were aiming for with that particular time period. And so after, finding just a little over 6,000 records and removing the duplicates and so forth, we came up with 59 included papers for full text review, in which we had 2 reviewers at the study selection phase and at the data extraction phase. So of the 59 papers, you can see that OT sort of comes out a little bit ahead with 21 papers, PT 17, speech language pathology 8, and then there were 13 papers in which included 1 rehabilitation profession and another discipline. So this could be nursing, psychology, etc. There were a few papers like that. So there are 4 major themes that came out of this review. One of them is the descriptions of attrition and retention as phenomena, experiences of being a professional. So looking at the level of the individual, what does that experience look like? And how does that influence their decision to stay or leave their profession? Experiences within the inner milieu. So when we're talking about the inner work milieu, we're looking at the immediate work environment in which that professional is situated. The ward, the program, the clinic, the department within the school setting, within that CLSC in the soins domicile program, it's those very specific experiences particular to the immediate environment that they're in. And then the experiences in the outer work milieu really refer to the broader work environment. So if we think about our example of an OT working on the stroke ward, the broader work milieu would be the institution in which that ward is part of, and even more so the health authority that they're part of. So, I'm thinking, for example, someone who works on the stroke unit at the Jewish General Hospital, and how the broader work milieu would be the institution as a whole, and then the Suisse Centre West as part of that outer work milieu. So let's go into theme 1, so descriptions of attrition and retention. And so that this really refers to, as I mentioned before, the correct characteristics of the phenomena and what we found in our review. So we found some papers related to the state of attrition. So what is happening with respect to our professionals at this point in time that the review was the paper was, the study was conducted. So how many individuals, in which countries, and what specifically was happening. So, the Australian study that I mentioned earlier was one of the studies that we looked at in the review. 65% of PTs from that Australian university intending to leave and the reasons for why they were leaving. And then when we look at also sort of with respect to this phenomena of attrition retention, we also extracted information with respect to the reasons for attrition. So some of these I don't think are surprising. Family responsibilities, wanting a career change. Some participants in some of the studies voiced a lack of career progression as a factor that pushed them to leave the profession and to seek out other fields or disciplines. Work-related harms. So the examples that come to mind are musculoskeletal injuries, in particular thumb injury with physical therapists, and burnout being very common across all 3 professions, but in different areas of practice. So speech language pathologists in school settings in particular experiencing burnout, OTs working in mental health experiencing burnout, or OTs and PTs working with stroke survivors as a factor for burnout. Work or workplace factors was also something that we extracted from the data, looking at, and here are some examples, the climate of the workplace, the managerial style, the amount of work, the amount of time spent on things that are not clinically based, so administrative tasks or accessing processes within a healthcare system, job satisfaction, etc. And then factors that influence retention, really related to this broader concept of support. And really just the word support doesn't do the code justice. The support is, if we break it down further, comes at multiple levels. Individual support from a day-to-day basis from our colleagues, from our managers, but also at a broader level, support with respect to universities and other entities that help to provide continuing education and so forth. So multiple levels of support is something I like to keep in mind when we see that word support. And then there are different forms of support, mentoring, supervision, and at different stages. You know, there's some papers that talked about the early stages of the career, but we also talked about support and mentoring and supervision across the career span. Some of the other aspects that influence retention was this interaction with clients and patients. There's no question that this is something I expect, you know, from health professions who are interested, in which individuals come into these professions because they want to help others. And so really it's those interactions that help these individuals to stay in their profession and to not consider leaving. Relationship with colleagues, especially if they were positive relationships, supportive relationships, also help to foster retention versus the negative relationships that over time can accumulate and lead someone to consider leaving their profession. Professional autonomy, so our ability to make decisions on a day-to-day basis, the clients that we see, the number of clients that we see, how do we see them, you know, how do we intervene, where the resources are available to us, also plays into retention. Workload, in particular, when we talk about workload, we're talking about high workloads or workloads in which there's a misalignment between the capabilities of the individual and the demands of the job or the work. And so that also came out from the different papers that we looked at. And finally, availability of other opportunities. So meaning that an individual will make their decision based on what else is available. So I decide to leave my profession or stay in my profession based on what else is out there that I can go to, how accessible that is. So, you know, certainly we see that within job retention and job attrition, but in career retention, that's a little bit more challenging in terms of, you know, identifying other professions or fields of interest and then taking the necessary steps to move in that direction. The second theme, experiences of being a professional, really falls under these 5 codes here. So characteristics of the individual therapist. So for example, looking at their skills, their attitudes, and their knowledge, you know, the idea of, for example, knowledge, you know, feeling competent in what we do influences our experience of retention, attrition. Life circumstances, so, you know, the physical demands of the job was something that came up often in PTs, meaning to say that as they age, they're considering whether or not they will have the physical abilities at a later stage in life to continue to meet the physical demands of their work. And certainly having young children under the age of 18 was also something that was talked about within the literature in terms of life circumstances that can influence attrition and retention. Choice making is very much, it's somewhat linked to this idea of professional autonomy, but it is this notion of having some sort of control over our schedule and how we plan out our day, and the work that we do and the amount of work that we do. Impact on the individual. So this code refers to how we experience it at an individual level as a professional. So an example here was, and this was mentioned often, that the changing healthcare landscape, has an influence on how we experience our work, and whether or not that leads us in one direction or another. In particular, when we talk about changing healthcare landscapes, we're talking about healthcare reforms. And then finally, identity. Identity came out in terms of, in particular, I would say with the OT profession, about the awareness of the profession, the visibility of the profession, and how, that visibility and that awareness in others, so in other disciplines, in the general public, can influence or affect the way we see ourselves, our own identities as OTs. The third theme relates to experiences in the inner work milieu. So role definition, in particular, roles that were not well defined or ambiguous, or in situations in which rehabilitation professionals were taking on a role or a task or a responsibility that is not within their scope. So the concept is what they call gap filling. You're filling a gap because someone has to do it. And so you decide you're going to be that person that's going to do it. Okay, so that also influences how we see our decisions to stay and leave the profession if we're not as comfortable in our role, if we don't understand or really have a good sense of what our role should be, or if that's not clearly delineated, that could influence our perceptions and our decisions. Workload, I've mentioned before. Support, I've also mentioned, and I mentioned it before in terms of the different levels of support. So our experiences of support within the day-to-day work we do can shape our perceptions of attrition retention. Teams, so this goes back to supportive relationships with our colleagues on a day-to-day basis, but it also refers to just the opportunity to experience teamwork in an interprofessional way. So those who had those opportunities and these were positive experiences, certainly contribute to their sense of retention. And finally, we talked a little bit about this before as well, but the social interaction, there's a social aspect to our work that is very important and something that's very positive in terms of retention. The last theme refers to experiences in the outer work milieu. So work opportunities in terms of opportunities for professional growth and career advancement. And so if you can think back to one of the earlier studies in the 90s that I talked about, this was something that was still present back then. In terms of institutional culture, we're looking at, for example, the values, the policies and procedures of that institution and how that could shape that professional's experience. Remuneration, so salary does come back as from the literature about being paid what we're worth. And I would say that this is sort of specific to particular contexts. One of the papers that I remember the most refers to OTs and PTs working in India and not feeling that they were remunerated enough for the studies that they did. And in this particular paper, they report that the participants, had they known that they were paid such a low salary, that they wouldn't have bothered to go into these professions in the first place. And then finally, work-related harm comes back as well in terms of, again, the different, different risks that are related to the nature of the work that we're doing, as well as the experiences of burnout and emotional harm within our professional experiences. So that sort of concludes the findings of the scoping review, and I went through them fairly quickly, so I'm happy to entertain any questions that you may have. But these are sort of the reflections that I'm having ongoing right now. So how are these findings, how do they relate to our Quebec context? So what are the pieces, the gems that we can take out and think about, and the things that don't relate, why don't they relate? How are these similar and different across OTs, PTs, and speech language pathologists? And I've already alluded in this presentation to some of those differences in terms of the type of harms that professionals experience, as well as the differences at a professional broader level in terms of visibility or the promotion of the profession. How can we further develop our understanding of attrition as a naturally occurring phenomena is something that that I'm also looking at in my PhD work. Is there is this sense of attrition as a bad thing, and it can be considered as a bad thing, but it can also be considered as a good thing, that it's just part of the natural process of careers, that we move and shift into different positions and roles, and that we grow out of one role and that we're ready to take on another. And then finally, what are some of the strategies we can implement to support retention? And I think much of that can be informed by some of the findings on factors that influence retention, but will also come from the interviews that I've conducted with rehabilitation professionals, and certainly from the focus groups with stakeholders. And so now, Shabby, I think we're ready for questions.
All right. Thank you so much, Susanne. That was a very interesting and very relevant to today's climate, I think. I'm going to open it up to questions. You can either write them into the chat, or you can raise your hand and then we'll give you the opportunity to ask a question verbally. So Philip, you can unmute yourself and ask your question.
Okay. Hey, merci, Susanne. Thanks. I'm wondering, looking at this, I understand as anyone who's a manager, we need to make the workplace as positive as possible. But I wonder if there's, if you, in your literature search, you looked at other careers outside healthcare. I mean, how much are the findings related to OT and healthcare, or how is it similar in other professions? I don't know, law, architecture, liberal professions, I guess, that could be somewhat comparable.
I have looked at some other professions, and one of them that comes out often is our teachers. And I think there is a relationship with rehabilitation professionals, you know, the social aspect of our work, you know, those day-to-day interactions is this sort of aspect of helping that's very common to both these professions. And so the attrition, you know, is something that is a naturally occurring process, and that I've seen in other fields of literature. You know, I can't comment on the extent of the attrition, but the reasons for attrition are very similar.
Thanks.
No problem.
Do we have any other questions, either on the chat, or you can raise your hand if somebody, give them a couple seconds. If not, I know that you had your email ready for people if they wanted to ask you questions. Bernadette Nedelec, yeah, you can go ahead.
Hi, Susanne, great presentation.
Thanks, Bernadette.
I have to say that I was actually surprised that the Quebec data was only 10 to 15%, because, you know, I think, I don't know exactly what the conversations were that led into your project, but I think some of the discussions that I remember with you and some of the discussions that we were having nationally, there was a sense that the numbers were much higher than that, because to me, 10 to 15% doesn't actually seem that high. And clearly, you know, that was a while ago, and we have very, very different circumstances today. So we can't make any statements about what's happening right at this moment. But were you surprised at those numbers? And again, have you, 65% in the Australian study is a whole lot different than 10 to 15. But again, when you're just talking about what you might do, you can say a lot of things and you might do things differently. But have you found any other data? And are you confident that that sort of is representative, or do you think that that might be an anomaly?
So the way in which the study was conducted, I think they pulled data from the orders to be able to gather that data. And it was a snapshot in time. You know, I think, you know, so I was surprised. I really thought it was higher than that, you know, and my studies have not been specific to the attrition we experience within the program or right after the program, right? There's attrition there as well. That's actually a population I'm not looking at specifically because I think the reasons for attrition are different. But I agree with you that I think they are on the low side. I haven't seen, I have seen other data around the 30% mark from UK studies, but nothing as high as 65%. And certainly, you know, I would probably estimate, and this is a total guess, that it's more than 10 to 15%. But, you know, I would also look at sort of a timeline of over the first 5 years, whether or not after graduation, whether or not we see attrition as opposed to the, you know, the first 2 years. And what are the contextual factors that fed into those 2 years that people left?
Thanks.
No problem.
There's a question in the chat, and then there's someone who raised their hand. So someone in the chat wrote, I'm wondering how gender studies can contribute to some answers. OT, S-LPs are mostly women, and first reason to come up is family duties.
Right.
And then they added, it's now rare to have in the higher education paths to have only one option after getting the degree. I think the quota should also take into account that some rehab professionals are going to take on coordinator positions in the part where attrition is not necessarily negative.
Absolutely. And so there were a few papers in our in our review that actually focused on men, in particular men in OT. And so there were some very different reasons for their desire to leave the profession, in particular related to feeling stereotyped within the profession, you know, feeling as if they were placed at a disadvantage or advantaged in other ways. So advantaged, for example, to proceed into managerial roles, and disadvantaged in terms of working with children. So automatically there's this bias that, you know, that there's something inappropriate going on if it's a male OT working with children. So those were a few of the studies that I did see in our data. And then it talked a little bit about how universities programs, you know, can contribute to those stereotypes. So that's where I saw some of that data. And I agree with you that, you know, the way I see attrition in my PhD work is not someone who's leaving clinical practice. It's someone who's giving up their license. And I think that's a very different scenario. You know, so you can be a manager, you can be a researcher, you can be a university teacher, you know, you maintain your license, you're still part of the profession, you know, but I think once you're giving up your license, it's a different story.
Yeah, we're going to go with the raised hand. Lat 2620.
Mary?
Hi, Susan. So nice to see you. Thank you.
Nice to see you too. Thank you.
As you know, management, it's very interesting to look at your presentation, and you know, it is one of our realities. You talk about attrition, but I'm also wondering if you've had the opportunity to also look in terms of leaves, because this is what we're also seeing. They don't necessarily give up their license, but we have a lot of requests for leaves, whether it's partial leaves or educational leaves. And this is also part of our challenge. So we are trying to adapt our styles, and we work very closely with human resources when you talk about having control, giving them options, whether it's rotations, whether it's looking at areas that they're interested. Every CS, we're organized differently by looking at the areas they would like to work on, to try to keep them, focus groups, work-life climates. We're trying everything. But the reality is we are seeing this increasing need or request of leaves. We're also looking very closely to address any issues, or if we have feelings of burnout, where we're trying to prevent this from occurring. But I just want to have a bit of an idea of the leaves, if this was something that came across in your research.
Sure. So what I didn't talk about was sort of my broader concepts of attrition and retention, at a big project level, as opposed to at this level of this phase one review, or review from like phase one of my study. So the way I see attrition and retention is a little bit like a continuum. On one end you have attrition, and on the other hand you have retention. You have the people who stayed, you have the people who've left, but then you got the people in between who fluctuate back and forth, right? There are people who leave and still wonder about whether or not leaving their profession was the right decision. And I would say that, the part that's very specific to leaves, there is some literature about how those who do decide to leave, they come back. So it's not a true departure from the profession. It's like just a little bit of a break or a pause. And I think the challenge in some of the papers that I've read is, how do we transition back into the workforce after we've been gone for a certain amount of time? What are the supports and the resources available to help us in that transition to the workplace? So whether that's from a refreshing clinical knowledge and skills, relearning how the healthcare system works, are there licensure steps that also help to facilitate? I don't remember if it's Australia or New Zealand, but they talked about a particular process that they put in place for people who leave for a certain amount of time and they come back, and how that process is a very supportive process, and it's from the regulatory body to be able to assist these professionals to come back into the workplace. So there are certain courses that they take, there's some mentorship that's involved, and certainly, within that, there's some relationship to the workplace, as you mentioned, about flexibility in terms of what that work can look like.
Thank you so much.
You're welcome, Mary.
We have 2 questions in the chat. So the first one says, did you see a difference in data in the past 10 years compared to health professionals before 20 to 30 years?
So that's a great question. I probably would have needed to expand the review to be able to answer that question, because I don't know the data that well, so I really know the data very well from 2010 and onwards. Before that, there wasn't, from a literature review that I did at the start of my PhD, there wasn't a great amount of literature available. If I think back to those 2 papers in the 90s, I think some of the contextual factors are the same. It's just our experience of what the healthcare reform is a little bit different. But the aspect of people leaving for parental, to be a parent, to pursue other career seems to be similar in that respect. So I can't comment very much on it, but that's what that's how I can respond to that question.
I think Carolina is going to want to expand on that, so I'm going to let her go.
Thanks for this. This is, it's just blowing my mind. I'm just like thinking all over the place. I had a million questions while you were talking, forgot half of them. Since we're near the end, I have what do we do with this? What are your thoughts? So you've read all this, you've got all these factors. A lot of them to me seem like, when you were talking, it was in your PowerPoint was written in a retention factor, but the words that were coming out of your mouth sounded like it was more of an attrition factor. It seems like they can really go one way or another. Yes. So what, just off the cuff, after doing all this work and identifying these, what are some key messages that you would give in terms of, what can we do with this going forward? What are some key messages that you walk away from? Okay,
so some of these key messages, I'm just going to preface by saying that in phase 2, I conducted 51 interviews with OTs, PTs, and speech language pathologists, and I've completed or nearly completed the data analysis for that. But some of what I'm going to say comes from that, and I've just run a focus group with some of the managers from the private sector in relation to retention strategies. So I think at a workplace level, as Mary very well articulated, there are lots of different things that we need to do to support professionals, especially when they're undergoing the impact of healthcare reforms being a really big one, but also the things that happen to them on a day-to-day basis, whether it's the burnout or the bullying or the positive things that they experience, that I think needs some work as well. And I think that can be helped through support and mentorship and lots of opportunities for exchange and discussion, which, if I think back to some of my participants, is a challenge in this healthcare climate. When you're alone in an environment and you don't see your manager and you're struggling and it takes you 6 weeks to connect your phone, there's a problem. So there are those things that I think, professionals are autonomous, but they also need support. And I think support on a daily, regular basis is how I see supporting retention at an individual level. I also see at broader levels, that there are also ways in which we can support retention through having conversations at a university level to be able to develop, continuing education courses and opportunities to help support our healthcare professionals who love doing continuing education, because it creates a spark of interest and passion for their profession, and other opportunities to engage in different ways in their profession. And now I'm going to draw a little bit from some of the mentoring studies that I have underway right now. Some of the things that the mentors tell me is how much they love being with the students, and how that being with the students helped to spark their connection to the profession. It reminded them of the highlights of the profession, why they came into this profession in the first place. So I think providing them with different opportunities to engage, whether it's by the university organizing it or through the workplace or some sort of a partnership, I think is also helpful for our healthcare professionals. So they expand beyond just the clinical role, but the other roles in which they can participate in the profession. And then I also see there are aspects at a professional level. There's work that needs to be done in terms of promoting visibility, recognition for the hard work that we do, and thinking about how our work tasks are divided to meet the various expectations at an institutional level, but also at a higher professional standard level. So that's also another piece that I'm sort of working with, and something that I'm going to think about for our focus groups.
Sounds to me like you would need to organize a huge thinking conference, where we all sit down at the universities in the clinical settings and we just think about this, because this is huge. I mean, if our graduates aren't well, it's big. It's environmental, it's internal, it's external. It's
yes,
we should be talking about this, and I don't think we have been. Well, I don't know. I haven't been hearing these conversations, so I don't know. Thank you for your work. I think it'll open up really good conversations.
Thank you very much, Carolina.
We're going to go with one more question from Aliki. You can go ahead.
Hi, Susanne. I just wanted to say great job. Can I just say one thing? I just wanted to add to Carolina. Stay tuned. Stay tuned, Carolina. The data from the interviews is incredibly powerful. And I think you will see that some of the suggestions you are making are absolutely avenues to be pursued. That's what Susanne is really interested in, is after hearing all these narratives, incredibly poignant narratives through 51 interviews. This is one of the first studies I've ever seen have no recruitment problems. We've been able to really get to speak to a lot of people, and you're bringing up some really key points. We're going to have to talk eventually. We're all going to have to sit around the table and address this. Great job, Susanne. So nice to see it presented this way.
Thank you.
There's a lot of praise in the chat for you, Susanne. A lot of people are very appreciative, saying that you're very clear, and it's something that's very pertinent to what they're living through right now. So you know, I can send you this, it just keeps coming. People are just saying thank you. So I'm just going to send that to you.
I think that'd be fabulous. Thank you. And thank you to all of you guys for coming to have this conversation today. One of the best parts of doing this research is all the validation I get about how important this is. And there's no question that I think, you know, Carolina's point and Aliki's point about sitting down and talking about it is one of the first steps.
Great, perfect. Thank you so much. And we're going to end it here. So thanks again. And the recording is going to be available on the CRIR website soon. So thanks,
Great,
everyone.
excellent.
I'm going to stop the recording.